Let's cruise on to question number 2. So this one is titled Exploring and Validating Patient Concerns, Relation to Prescribing for Depression. So this one was by Ronald Epstein, and it's in the Annals of Family Medicine Journal from 2007. So we're looking at patients that are going to be prescribed depression medication. And your question is, in visits where there was low EVC, so EVC meaning exploring and validating concerns, the doctor's prescribed based on A, brand name medication, B, the patient's request for medication, or C, the patient's presenting symptoms. So in visits where there was low exploring and validating concerns, so as in the doctor did not really evaluate and validate the patient's concerns, how do you think the doctor prescribed? Did they just pick the first brand name medication? Did they choose whatever the patient wanted? Or did they look at the patient's presenting symptoms?
I feel like this could go either way because, I'm on antidepressants myself. And so I know that usually the first trial doesn't usually work of whatever medication that they're on, but luckily mine did successfully. But I really feel like if you're not listening to the patient's concerns, and just prescribing just to write a pill, this is what some providers feel like a patient wants, but it's actually not. They're just
kind of blanket prescribing in that case.
Yeah.
All right, you guys got your answers? All right, let's see them. All right, we got A, and C. Okay, let's see where we're at here. You guys were all wrong.
I was hoping and praying I was wrong.
Yeah, right?
Well, but I thought this was super surprising too, though, is they just kind of whatever the patient said, they're like, yep, whatever, like, let's try it. Patients had better outcomes when there was high of like the exploring and validating their concerns because they weren't just given the medication that the patient saw on TV, right? Where they're like, I saw this is what I want. And in this case, the doctor is just writing, okay, that's what patient wanted to try. Anyway, just interesting topic.
That's interesting.
Mm-hmm.
Yeah, I feel like this could go a lot of different ways because in the way you respond to somebody coming in and saying, I want this medication, I know this would help me. The way you do could go in a lot of directions if you don't validate their concern. Even if you don't agree with what like say at the end, like, I don't want to give them that. I don't think that would work for them. How do you, alleviate the concern? You have to go down a whole route to build their trust.
Yeah.
To have them listening.
Without just saying, no, well.
That happened to me. Not really as medication, but like when I was having my first son and I went in and I told them I wanted an unmedicated birth and he laughed at me. Yeah.
I had similar. I said, like, I don't want to give birth on my back. And the lady said, oh, well, that's the only way I'll deliver. I was like,
yeah. I was like, okay. But yeah, I was like, I'm done listening to you now.
And yes, I found a different provider. How about you?
Yeah, I went through quite a few until I couldn't go to anymore. And I was stuck because of how far along I was.
Oh, yeah. That happens.
But yes, no, this is a tough one because you want to make sure you're advocating for what their needs are and listening.
Yes.
And directing them correctly so you're not just giving them something that's not going to work. It's not. Yeah. So that's a good question.
Yeah.
Thanks for tuning in to this episode of Trust Driven Trivia, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Join us next week for more laughs, new guests, and fresh questions that turn medical research into pure fun. Trust Driven Trivia, making healthcare knowledge exciting, one question at a time.